Safe. We are safe. The office is safe.
We're safe from
We're
a
safe.
hurricane.
Couple blocks from here, not so much, but we're good.
Thank God.
Yeah.
They did flood it.
Yeah, it flooded some places. But as far as getting hit by the hurricane, we were lucky not to get hit by the hurricane.
Yeah, Sharice asked me, she's like, how's it look over there? I took a picture and I walked around. I walked through too. I didn't see anything. It was dry. Like you could see dry spots on the road.
Yeah, that's
and then
good.
I felt bad because I posted like all this hurricane hype for nothing. And then 5 minutes later, everyone's like, I'm flooded in. I'm stuck. So I felt bad. So that's my bad, guys, for everybody's out there that did experience flood
All right.
stuff.
Kinsun Bay, Sour, J. Jacobs, MPW, The Bearded Tony, Hoffy Dad, Richard, Lifts, Holiday Stack Sales. We have a Bloodwork sale going on for Labor Day, and then we'll talk about that in a second. Jose, Master, Richard, Jose, what's going on? Fire Latasha in the house. Jose, Tip Guy, what's going on? Everybody join us on TikTok, I guess YouTube, everywhere else, Instagram. Thank you guys. Welcome. Friday, Titan Lifestyle with Big Drew.
That's right. Friday, we're right back every weekend, or I should say weekday. Friday, 2 p.m., we do this live.
Yep.
You guys know there's been a hurricane.
Yep.
We're here in Tampa, Florida, so nothing hit the office, nothing hit this area, nothing hit his house or my place.
God.
Couple places got flooded, but I haven't really seen any major damage.
Yep.
And it wasn't like a lot of power outages like last time. So luckily everything was good.
Yeah, it was definitely better than the last hurricane we had as far as that goes, damage-wise and all that. So God bless. They say that Tampa is blessed by a tribe, and that's why, an Indian tribe, and that's why they haven't got hit. I think it's been over 100 years. So I hope that's true, and God bless him and blessing us, and hopefully not being able to get hit by a hurricane. So,
Yeah.
'cause I heard there's another one, like a tropical storm brewing again right now in the Atlantic.
Yeah.
So we'll see how it goes. But listen, we got a great show for you guys. We're going to talk about the therapy of the week, which is IGF-1 LR3. It's back with Titan Medical Center. And at that point, the benefits and everything, you might get a little discount on this thing too as well.
Oh, yeah.
So we'll get into this. So if you have any questions about what we do or how we can help you guys out, anything from hormone replacement therapy, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, libido enhancers, peptides, and blood testing, of course, and anything else that comes with making you guys look better, feel better, and perform better, we got your back. It's nationwide service, 727-389-3220. So let's get into it.
First off, we have a blood work special. He just said blood work. I want to bring that up real quick. Blood work Labor Day special, guys. $130 for men, $200 for women. You're saving about $100 for the women. You're saving about $70 for the men, and that's just our savings. So I know a lot other places. I heard some lady the other day said she paid almost $400 for her blood work, full panel. So we do full panel hair, and there is a special. So call 727-389-3220 and let them know you want the special, and they'll take care of you.
The blood work special will go on, and it will end on Tuesday because obviously Labor Day is on Monday. So I hope you guys are planning for a great weekend with your family, friends, or something to enlighten your weekend. But enjoy Monday, but Tuesday the special will be done. So it'll be the last day you guys can take advantage of it. So you say, hey, I seen an ad, and it's like Wednesday. I'm sorry, we're not going to be able to honor that. But at that point, you can take advantage of two specials. So IGF-1 LR3 too is back. Insulin Light Growth Factor 1, and this is a long-lasting one in the body, has a longer half-life than regular IGF-1. And there's so many different benefits from using IGF-1 therapy, right? Like basically your hair, your skin, your nails, your muscles, and helping you out growing lean mass with good growth there as far as that goes. Weight loss, better sleep, all this stuff that comes from growth hormone. It gets changed in the liver down to IGF-1, 2, and 3, and IGF-1 is where you get all your benefits from growth hormone. So at that point, it's been used for a long time as far as we've had it for, I think, 6 years, and it went away for a little bit. Like I said, now it's back. I'm on it right now. I'm recovering from hernia surgery. I think it's day 10. And at that point, I'm throwing everything I possibly can in it to heal the best I possibly can, the fastest, because I need to get back in the gym. Olympia's coming.
Oh, yeah. 9 weeks, I believe.
And, just with talking with Drew, or everybody else is just getting ready for this thing. I'm ready to get back in there. And, of course, I don't want to hurt myself or redo it because I don't want to go underneath the knife again.
Yeah, your strength's going to be through the roof. The pump's going to be crazy. That first workout back,
I can't wait.
You're definitely going to be crazy.
I can't wait.
And one thing about IGF-1 LR3, too, is I have a lot of people asking me, whether it's in person or messages through social media, Isn't it the same as growth? Isn't it the same as growth? It's not the same as growth. I actually like IGF-1 better because you're not going to have to worry about enlarged organs, feet, heads, and all that stuff. Yeah. So it's a little bit better. It depends what you're using it for. But if you're using it to muscle build, for fat loss, it's not going to make you sleepy the way growth hormone is. Yeah. So if you guys hear HGH or GH, that's what we're referring to. So a lot of times if you look it up online, you'll see IGF-1 LR3 versus GH or HGH. Yeah. If you take GH or growth hormone, you're going to be sleepy. You're going to have a lot of water retention. A lot of times people get edema from it. And again, if you take too high of a dosage, you're going to have enlarged organs. Once your organs get too big, they're not going to shrink back down. So if you're a guy that's a big muscle guy and you want to put on muscle, you start taking some growth hormone. Those are those guys that have the turtle shell stomach because their organs are actually big. Yeah. They lose all that muscle and now they look like Humpty Dumpty. They have skinny arms and that's still big. That's true. So that's one of the things you don't want. Yeah, you don't want to have that. So
hold on, what's going on? Brunette Barbie, what's going on? So at that point, so IGF-1, listen, I always want to tell you the benefits, but if there's any negative side effects, and there's negative side effects to anything, and there's risk with anything, right? With growth hormone or IGF-1 or even GH or RPs, you're going to have some sort of risk if you have a negative health history, right? So that means that if you had somebody in your family that possibly had cancer that's really close to your mom or dad, or if you had cancer previously, you could be susceptible to growing good cells and bad cells. So this doesn't go through the body and say, oh, well, these are the good cells, let's enhance these. Well, these are the bad cells, let's not enhance these. So that's the only caveat to it, right? I always like to tell you guys the good and the bad. There's always a risk of anything that you're going to take. So at that point, just, have that. But that's what our medical providers are here for. Yeah. They're here to educate you and to know what's best for you. So by us doing that and having the medical consultation, it's not some 5-minute consultation you're going to have with the provider. It's going to be 30 to 45 minutes. So at that point, you're going to be able to have in-depth conversation with the medical provider. They're going to get to know you as far as your symptoms, your blood work. If you're taking IGF-1 LR3, you're definitely going to get blood work done. Yeah. So you guys know that too in advance. But all that health history, your family health history, just be honest about it so we can help you out the best we can.
And if you guys don't know your family history, if you guys don't know your family history or this and that, you can get that tested. You can go out and get every test you need to get. Make sure there's no cancers in your body and all that. Make sure you're safe beforehand. Okay. So I know a lot of times people, some people, they don't know what their family history is, so they're kind of playing Russian roulette. Just do all the proper precautions beforehand. If that's the situation you're in, make sure you're testing everything. Because again, like John said, if you have something you don't want to spread, it could spread the good, but it could also spread the bad. So just make sure everything's in line before. And the blood work isn't going to show some of the testing I'm talking about. Any type of cancers and stuff, the blood work's not going to show that. So get that done separately. Get your blood work. After that, you're ready to go. You have nothing to worry about. IGF's going to make you feel good. Mm-hmm. I know guys are leaning out off of it. I know for some reason guys say they get a tighter waist and core. I get my abs back. I need the IGF. So I don't know what it is, but that's just from what I hear. A good friend of mine's the same way. He always like, summertime's coming up. I need to get my waistline tight. I need to get back on the IGF. So.
Well, you're talking about, helping out with collagen. You're talking about elasticity for the skin, which is a big thing. And then we're talking about recovery, enhancing recovery. With IGF-1, we're going to enhance recovery better. So, you're going there, you're going and working out, you're busting down and breaking down those muscles. And this is going to help those muscles repair and build back better. I don't even want to say that phrase. I don't like that phrase anymore. Right. It's going to build into a stronger muscle, and it's going to look a lot better. The build back better. I just don't like
build back better.
Yeah, that
doesn't sound right. Build back better sounds like.
So that's what our president's. That's a slogan.
Doesn't sound right. Build back better sounds like. There should be it sounds like grammatically incorrect. I don't know.
It does. Christian, what's going on? How you guys doing? Nathaniel? All right, so we have some questions on TikTok. So how do you buy? So the first thing you have to do is call or text 727-389-3220. And then we have an ultrasound text that normal livers are 15 to 18 centimeters. Powerlifters are often 20 plus, which is dangerous. So that's a pretty good fact. I've never had somebody come on here and tell me liver sizes as far as that goes in comparison to a normal person to a power lifter. I thought Kimball's size was dead. Of course, everybody gets that. There's an ad with Drew that's up on Instagram and Facebook, right? And the ad always gets it. that Kimbo Slice, and then somebody will comment, that's not Kimbo Slice, and they'll tag you and stuff like that. So it's just funny, but yeah.
I was at a restaurant one day and some guy came over, asked for an autograph. I was like, look, Kimbo died years ago. Years ago. I didn't know if he knew who I was from, Titan or other companies I've been with videos. He just came up, he was standing there for a second. I'm like, okay, he's probably gonna ask for a picture or something like this. And he's like, hey, let me get your autograph. So, okay, I'm thinking he's saying all this for Big Drew.
Yeah.
And then next thing you know, he's like, Kimbo. He's like, or something about when's your fight? And I was like, what? Kimbo Slice, right? I said, nah, man. I should have signed his autograph just for a joke. Though.
Right? All right, so Nathaniel Pendleton, is the lab special you guys are promoting real? Yes, of course. 100%. We've been around it's coming up on 11 years in October. So we've got pretty good track record as far as that goes, and we've been around for a long time. So, the blood special is definitely real, 100%.
If you guys see anything...
130 for guys, 200 for females. There's more testing on the female panel. I get that question, well, why is it, why is it more money? And that's the answer to it.
Yeah, if you guys ever wonder if it's real or not, if it's on Titan's page or my page, or it's definitely real. You can always call, too. Just call 727-389-3220 and ask, hey, I heard about this. Is this true? I mean, if you really have to. But if it's on the website, if it's on any of Titan's pages of mine, yes, it's real.
Strength Dad's asked, been getting a few questions about IV drips. There's several options, folks. It's a great excuse for a Tampa vacation. Visit titanmedicalcenter.com. So IV drips obviously have to be done in-house. But if you're in a different city, per se, or state, and you can't get over to Titan Medical Center to get a drip, at that point, you can get some of our different special blends that have a lot of different things with one little injectable. Now, nothing is going to be superior than an intravenous fluid going in your body or vitamin or anything like that. But the second best, and it's really high up on the totem pole, would be the intramuscular injection with a little insulin needle and being able to get a lot of these different things packed in you real quick. Going to the fridge, taking it out possibly, or in your cabinet, pulling it down with your syringe, cleaning the spot, injecting the area, and you're on your way. So 5 to 10 minutes out of your day can get a lot of these different things. The only thing you cannot get out of that is going to be the hydration portion. So that's the water that's in the bag, the saline water. So at that point, that's the only thing you wouldn't be able to get. But hey, listen, you can drink water and take these injectables, and you'll still be on track to do what you need to do.
Yeah, there's plenty of blends too. Even Hercules Potion is a blend. Yeah. It's got a lot of stuff in the NAD, Crichton Complete. Yeah. A lot of this stuff is a blend. Yeah. If you guys want a good sleep blend, Titan Serenity too. That's probably the least talked about therapy. Yeah. If you guys are having trouble sleeping, Titan Serenity. Yeah. It's got good quality ingredients to put you to sleep, not put you out, not make you pass out, but slowly get into that REM sleep.
So I've got some different things that we're going to be introducing here in the next couple of weeks, new therapies that we've never had before. And there's going to be some good benefits from these therapies. And I promise you're going to like these things. So it's going to be something totally different than we've ever done before. I like it. I'm excited about it. It's going to be really good. What's the cost on Stephen 2K on what are you asking what the cost is? Tristan and then Nathaniel, yes, the $130 for the male panel would be the price. Thank you, Art. I appreciate that. Art's on there. All right, next one. What's your opinion on TRT? I'm 46 and starting to feel the effects of aging.
That's a good age to start.
I would definitely blood test. That's the first step. We can set up your blood testing wherever you're at in the country and take care of you with that. Or you can go somewhere else and just take advantage of the blood work special. You're not going to get it any cheaper anywhere else in the whole country, I promise you. If you do, I'll match it and go underneath or whatever you find. Test for test.
Yeah, don't screenshot something from 2008 either.
Yeah. It's still, it would be more expensive for you guys back then. But, at that point, 46 years old, blood test. Now, if you're feeling the effects of aging, this would probably be, inclined to low testosterone possibly. Because, if you're feeling the effects of aging, it's usually, I'm tired, the skin elasticity starts getting bad, you lose motivation, you might be a little grumpy. All these different things can happen. So, find out what's going on first, make an educated decision on how you want to fix it. If it's testosterone, you can fix it. If it's estrogen levels, you can fix it. That's automatically going to be balanced on a hormone replacement therapy regimen with us for a male or female. So at that point, really, I think at 46 years old, that's going to be the fountain of youth for you to a certain degree. It's going to take you back, give you the energy, give you the motivation, more self-confidence and self-esteem about yourself. I just got wait till you see this. I didn't even get to show you. So I just got this this transformation from a Titan patient today, and he wrote us a letter of how he's changed his life, and how
Jimmy?
No,
oh, okay.
no, and how he thinks about himself, and all these different things. It's crazy. And then he sent us pictures,
Oh wow.
and the pictures were,
Yeah.
I was like, wow. I was like, this is awesome, and he's like so excited about. He was like, I wanted to spread the word of Titan because of what you guys did for me. So it was really exciting.
Nice.
But no, it was really cool. But yeah, man, it's something that I think that if you need the help there, it's okay to fix. There's a lot of people that say, oh, this guy's on steroids, that's why they look like that, or the guys are taking steroids. Like, listen, all right, testosterone is an anabolic steroid, yes, but it's a steroid that all of us have, males and females. So to take it back to a natural range, or higher to that range, to the top of it, there's nothing wrong with that. It's just taking you back to where you were at probably where you were 18 to 21 years old.
Yeah, because I hear one of the main things I hear in terms of not feeling right, especially for men, it's loss of libido and being lethargic. Those are the two main ones I hear. Oh, I just have no energy, I have no sex drive, and then it's usually sometimes no appetite. But if you're crying watching YouTube videos about class reunions, your estrogen's high.
Yes.
If you're lethargic all day long, your testosterone's probably low.
Yep.
If you have no sex drive, whether it's with your wife, your friend, whether you see a girl on a video or you just have no desire, your testosterone's probably low. So
definitely,
rather than take an ED medication just to be able to perform, get your blood work done and get everything in control. That way you won't need that. That will be an added benefit if that's something you decide to do.
Well, that's the thing, right? When people start feeling this effect, to them it's like, all right, I have low energy. I'm waking up tired. All right, I need to get coffee and drink a lot of it. I need to go energy drink, take a lot of it, a whole bunch of pre-workout and take a lot of it. And they cover up that symptom. So they mask it. So they're getting away with it. And then let's say they're having ED, right? Erectile dysfunction, or they just can't get it up. They're going to the doctor, and the doctor's like, all right, well, here's some Viagra, here's some Cialis. Well, I'm feeling kind of depressed. All right, here's some antidepressants. So they're feeding you these different things to mask whatever's going on instead of getting to the general root of the problem and fixing the problem, so you can get back on track and starting, living life again at a higher level of quality.
Yeah.
So at that point, that's what it's all about, too. It's all about quality of life and how you live. If you live 100 years and it's the worst 100 years of your life, is it worth it? If it was 90 of your best years, would you trade those 10 bad years in for 90 years of greatness?
Yeah,
I would, a million times over.
Easily.
If I and trust me, I don't want to die, and I want to be around as long as possible. But at that point, do I want to be at a low point of quality of life my whole life? Probably not. Probably not. And a lot of people don't want to be like that. So there's options on the table for you guys to get help or to at least see what's going on. Yeah. And that's the biggest thing. Like, you don't have to take any of our therapies to get blood work. You don't have to be a patient to get blood work. You call, you want to get blood work, and that's all you want to get. Cool, I'm good with that, because at least you're taking your health in your own hands and seeing what's going on.
Yeah.
I mean, it's the biggest thing I see.
See, one thing too with men too is a lot of times women will have hormone fluctuations with their menstrual cycle. So a lot of times every month or every other month, or guys, you probably experience from your wife, girlfriend, they get a little bit moody, this and that. And it's because their hormones are off. Men can have those same type of hormone triggers. So even if your sex drive is up, even if you are not tired, if all of a sudden you're just quote unquote moody, and you just, certain things irritate you, or you're more emotional, that could mean your testosterone is out of whack. So women always have, my hormones are out of whack, my periods come and this and that, and they act a certain way. Men, we keep everything inside anyways. We don't have an excuse. Right. So a lot of men, your testosterone might be off. So you might just seem irritable, or you might not want to go to certain functions or this and that, because
you might be super submissive.
Yeah.
Super submissive, dude.
Yeah,
guys, there's some guys out there have testosterone that are good and they're submissive. That's cool. That's their own thing. But I'm telling you, there's a lot of people out there, especially guys, that are low in testosterone, maybe high in estrogen, and they are very submissive like a female. It's because the hormones are reversed. Where estrogen is higher than testosterone. So get it fixed, guys. You don't have to be like that.
And if you're one of those guys where you're dating a female bodybuilder, now we're talking about, a lot of female bodybuilders have higher testosterone levels because they're doing stuff the wrong way than their partner. There's a male.
Right.
So
right. Definitely not cool.
That's
Definitely not cool.
Be
Hulk
safe.
Squad, what's up? Megan, Melina, what's going on? And then, so we have a thing on here. So Carpe Diem said, the sheer fact you act like dudes are taking a natural amount of testosterone is laughable. So listen, this guy on TikTok, Carpe Diem 420.
The sheer fact that what was that?
So the sheer fact that we act like dudes are taking a natural amount of testosterone is laughable. Mm-hmm. So let's respond. We're going to respond in this point. We understand that there's a lot of people out there that are taking things the wrong way. That means they're taking exuberant amounts of testosterone or anabolics of some sort. We're not promoting that, and we're not saying that. We're saying that the regular average guy, and most of our patients are regular average people, right, are taking a clinically researched dose of testosterone that got FDA approved. So they've done 100 milligrams, they've done 200 milligrams, and they've done the clinical research on it, and that is what works best. So if that's what they're prescribed here, that's what most of them are taking. Now, can somebody probably maybe doing their own thing, I guess, on the side or adding in? I don't know. I mean, if we catch them, they're done. But at that point, we are in the business of helping people get to the highest point of the natural reference range, so we can make sure.
Another thing is, too, I mean, he has a point, not a point with us, but he has a point where a lot of people, because look at their weight, look at what they look like 5-10 years ago.
No, for sure.
If you looked at what I looked at 5-10 years ago, I was 20 to 25 pounds heavy, but I was full of water, full of estrogen, because I wasn't doing stuff the right way. So now, if I'm used to being 305 pounds and now I'm 280, 285, then clearly my testosterone is a lot lower than what it used to be, but I feel a lot better, I look a lot better. So a lot of times guys say, oh, well, he's taking this much, he's taking that much. Look at what they look like naturally, or even before they worked out. I see, there's a professional arm wrestler, top in the world. He's like, no one's even close to this guy, 440-pound guy. He was 200 pounds when he first started doing the arm wrestling. He was fully grown. Wow. So he's literally over doubled his body weight. Wow. So I'm not trying to call anybody out, but when you look at situations like that, that's where you may be like, okay, something happened where him to gain 104 or 240 pounds, where people like me, John, other people you see, if their weight pretty much stays within the same range, then they're pretty much, eating clean, not eating clean, in the gym, not in the gym. When guys go up 30, 40 pounds over a summer, that's when you really have to worry.
Absolutely.
Absolutely. That's when stuff goes on.
And the whole thing about it is, too, let's just, caveat that, is those guys, even putting on the amount of weight, they have to work for it. Yeah. So there's guys that I know or I've seen before, and people have come in here that are patients, and they tell me they're taking like 2 grams of testosterone a week. And
that's crazy. That's a whole bottle. That's crazy.
Dude, so... I'm like trying to wrap but the thing I'm trying to wrap my head around is not the dose, because that's just extreme, but the way the guy looked. The guy was like 165 pounds wet. Yeah. So at that point, like, I don't care. And the guy was telling me, he's been this thing for like 2 years like this. I'm like, well, at that point, like, what are you doing with it?
I want to know where he's getting his testosterone.
Because his testosterone level was through the roof. It was through the roof. Yeah. So it wasn't like it was bunk. At that point, if it's taking bunk, I'll be like, oh yeah, well, that's why you look like this. But you still got to work. But at that point, Drew's got he's got the biggest point there, man. That quality over quantity and extreme doses are not always the best thing.
Yeah, you just got to look at where people were, because certain guys are big natural. I mean, Ronnie Coleman became pro and was competing in Olympias. He wasn't winning, but he did that all natural. Yeah. And then look at the potential. He sprinkled a little bit of stuff in there and became the greatest of all time. So a lot of people that do get accused of using anabolic steroids, male or female, they're usually way more structured than the people that aren't. Usually they're in the gym. I'm going to the gym every day. I'm eating clean. I don't eat bad. I make sure I get my rest. I don't party. So certain things where when you look at people automatically think there's a magic pill or magic injection where you could just take it and walk around and not work so hard. You're still going to have to work hard. Even if you're on HRT or whatever you're taking. I mean, if you take Hercules potion, you're going to want to do some push-ups. You're not going to want to inject it and just sit there. I mean, your body's going to get good nutrients and good aminos from it. But to utilize it for what it's for, you're going to have to work for it.
Yeah, absolutely.
And I tell people a lot of times, if you're getting into bodybuilding or getting into working out, get the foundation right. Get the workouts, get the food, get into a routine and all that stuff. For sure. Then start sprinkling stuff in there. Guys are doing it backwards now. They are 100 pounds overweight, never had a gym membership in their life. I'm going to go sign up to this bodybuilding gym. I'm going to call Titan. I'm going to get HRT. I'm going to find the biggest guy in the gym to buy some whatever the hell it is he's selling me. And then those are the guys. They go from 180 pounds to 250 in like 3 months. And they can't catch their breath. They're bloated.
Yeah.
And you see their faces red all the time. They just look unhealthy.
It does, dude.
It
does. It looks like they're about to have a stroke or pass out or something. It's crazy.
That's not good. Got to work for it.
Optimize Raj. Shoulder pain, shoulder injury, BPC or what? So definitely BPC 157 and TB 500. And that's what I'm currently using too as well on my regimen to get back to healing and being to the level where I can start training.
Where are you putting it? You putting it like close to
I'm putting it. So I have to wear this compression belt.
Hernia belt?
So literally, like, I'll put it, like, right here, like, in the stomach area.
Yeah,
like
sub-Q?
Right, sub-Q, kind of to the side of the navel, because I had an umbilical hernia, so they went through the navel, so that's where the cut's at. So I inject close to there with the BPC and TB500, and then I do my IGF-1 on my shoulders, because it goes all synergistic through the body. So, because I need the shoulders anyway. They hurt me anyways right now. And they hurt, honestly, my shoulders hurt me more if I don't work out. If I don't work out for an extended period of time, they start getting achier, and it's just really weird. So it's
allowed to
like
stretch? You're allowed to, like, stretch?
Yeah. So, I mean,
you can still
I
get
stretch,
blood flow.
I can do all that. But
do, like, the little rotators and get the blood
I actually
in
have this thing that you spin this ball on. It's supposed to help heal your rotators. So, been doing that. But, BBC 157, TB 500, definitely. All right. So, Tank said, I've been on it for a year now. I don't have to give blood. I heard you don't have to give blood if your hemoglobin isn't high. So, if you obviously you're talking about testosterone. So, hemoglobin, hematocrit, and red blood cell counts are what you want to look at there. Now, if those levels aren't high, no, necessarily you don't have to get your blood donated. But would I maintenance and do it? Yes, I would do it at least twice a year. That's why I just call it HRT maintenance. It's a good thing. You're getting rid of that old plasma. You're getting fresh plasma in there in blood. It's recreating. So at that point, it's a good thing. It's kind of like a little oil change for your body. It really is. I can, because I mean, even in dialysis, like they take blood out and they recycle it and they put blood back again. That's how it works. So it is what it is. So I think at least twice a year, maybe once a year, either or. It doesn't matter. If your hemoglobin, hematocrit, red blood cell count are high, go do it.
Every time I hear that word oil change, I think of that movie, The Program.
Yeah.
Remember Latimer? He got the oil change.
Oh,
that
dude.
movie was crazy. Yeah.
They don't make movies like that anymore.
Yeah, they don't.
I was thinking about the other day, because I want to show Peter that movie. And I remember watching that movie in the movie theaters. And the quarterback, and I can't remember his name, was, he's in the opening scene, and he's laying on the ground, right? And these cars are flying right past him.
On the highway, yeah.
On the highway.
Yeah.
Right? And he's like, I'm so good under pressure, and that's what I was doing. I remember them taking the scene out because there was people that actually did the stunt and got killed. And at that point, they didn't want to be liable, I guess, for the movie. So, but the movie was just ridiculous.
That movie, I used to watch
Lalamier,
Vladimir, when he found out he made first team defense, he goes in the parking lot, puts his head through all the cars.
Breaking glass in his head for sure. Yeah. So, and that's the stereotypical people when they think of people that are on testosterone. Yeah. They're going to be like that. You're going to get all crazy and rage out and just do things you would never do, right?
He was a lot more than testosterone.
Of course. All right, so...
But I just think of oil change when he went to see his little trainer. He's like, don't worry, I'm going to just give you an oil change. I'm like, wow.
Oh, yeah. And that's essentially what he did.
Yeah.
He took out the bad urine, replaced it with good, so he could pee clean for the NCAA.
Yeah.
All right. 30-minute warning, guys.
30 minutes. All right, so we got some time. All right, Fuller pumps. How do you mix and administer IGF-1? So... Mixing would be with bacteriostatic water, and we would let you know what that is if you were a patient, because different doses will require different levels. We always do it 1-to-1. So that would mean the dosage to the bacteriostatic water, whatever that is. At that point, administering, you could inject this bilaterally in the muscles that you're training that day to enhance muscle size, hopefully, and the growth in that area. Or you can inject it subcutaneously in your stomach area. It works systemically throughout the body, so at that point, you ain't got to worry about it just being localized in that area. It's going to work all over. You're going to get all the benefits either way.
Also, too, when you guys are constituting, when you hear constitute, that basically means how you mix it. When you're putting your water into your vial, don't squirt it in there real fast. Just kind of let it go in. Yeah. And once it's in there, don't shake it. No. I mean, you can rotate your hand a little bit.
Yeah, swirl it.
Yeah, swirl it. But don't shake it. Don't tip it upside down the way you would mix up a water ball.
Definitely
just let it. And make sure it's clear where it looks like water before you do anything. Yeah. Make sure everything is dissolved It's not dangerous if it's not dissolved, but you just want to make sure you're getting the proper dosing. No. And if there's stuff in there that's not fully dissolved yet, you don't want that to move around. So it doesn't take long. No. A few minutes. It's not like you have to let it sit and wait and wait and wait. 60 to 90 seconds swirling, dude, you're good. Yeah. I usually mix mine up. By the time I mix mine up, I'm taking my Hercules or whatever else I'm doing. By the time it's clear, so just make sure you don't shake it up, and make sure you keep it refrigerated. Don't leave it out all day and then put it back in the fridge, or don't leave it in your car, especially this warm weather. Heat. No, definitely not. Yeah, even definitely people, it's only for a couple minutes. 5 minutes in a 120-degree car is long enough. It's not good. Especially because these IGFs, they're in clear bottles. It's not amber bottles, so you have to watch out for that sunlight as well, too. Especially direct sunlight, absolutely. Yeah, you don't want to spend your money on this product and have it. Just make sure it's stored right, make sure you do it right, so that way you get the most out of it. Yeah. The thing what Drew was saying about, just letting the liquid, make sure you're angling that needle towards the glass portion of that vial, and then you're letting that water go down that glass into the powder. You don't want to shoot directly on, like Drew said. Yeah, so basically what you'll do is if this is the bottle here, instead of going straight like this, put it this way. Exactly. So that when the needle goes through here, it's hitting the glass and then running into the substance. So you're not just putting it straight into it and splashing it all around. So just angle it, put the needle here, and then it will hit here and then fall along the glass into the thing. All right, and what else we got here? You recommend women testosterone injections or cream? Really depends, Julie. At that point, we offer all different transportation rates inside the body. So what does that mean? We have vaginal inserts for females. We have a cream that you can rub on. We have troches that you can do sublingually, or you can do an injectable. It's really what is the best for you. And different women react differently, I guess, or get better effects than the others in these transportation rates. We don't like to do injectable unless, we've tried maybe a different method, because, a lot of females don't like to inject and stuff like that. And we just want to make sure that we're controlling your levels. We want to keep your femininity. Yeah. Also, make sure you look like a female. Exactly. And also, too, if women are asking about testosterone, it's going to go off of your blood work, too. So don't just think that you can call and get your blood work done first to make sure you even need testosterone. Yeah. And once you need it, then you could take proper precautions or however you want to administer it. But make sure you need it first. So don't just. Sometimes people will call Titan Medical, and I don't even think this is a bad thing, because this is something that I could see myself doing back in the day. They'll call and they'll ask certain questions, and then they'll go do it on their own without getting their blood work done. Right. So in other words, if a woman calls now, hey, how do you feel about women taking testosterone? And we say, it's, you can do it this way, do it that way. That doesn't mean you then go get your testosterone and take it. You still want to get your blood work done. So if you hear us talk about things on this show or other shows, just make sure that it's assuming you need it. It's assuming it's reflected off of your blood work, not just telling you, yes, women can take testosterone. Absolutely, yeah. I mean, we won't do that at all. So at that point, and we're not going to give you a protocol of how you're going to take medication until you prescribe the medication. So at that point, then you can understand of what it's going to take and how much you're going to take and all that good stuff. Males, too. If you guys come in here and your testosterone levels is 1,500 or 2,000, don't expect to get testosterone. It doesn't matter what your last HRT place said, or it's just not going to work. You have to be in a deficit to get it. Otherwise, we're doing illegal stuff. Yeah. That's the reason why these other companies don't last, because they'll just go in there, hey, fill out this paperwork. My friend said I can come here and get this. And then 2 years later, they're not even in the same location, and they're off the planet. Andy J., I'm an ex-powerlifter and was 280. When I got put on TRT and I bumped up to 330, how can I lose size? All right, so you're gaining weight on TRT, right? Are you taking an estrogen blocker right now, and have you tested your levels? Because at that point, a lot of people start gaining weight. If they go on with like a general practitioner, usually they'll only get testosterone. They start taking that testosterone. It starts aromatizing. That could cause fat deposits, or you to put on more weight. And at that point, we want to check that out. But we have some different versions of weight loss therapies that can definitely help you do it for sure. Now, what did you do to go from 280 to 330? That's 50 pounds. I'm just wondering, was 280 when you were getting ready for a powerlifting meet or eating a certain way or training? Does your diet and training change at all? Because if it did, the weight could be from your diet, not just from the high testosterone. Yeah, for sure. Point 6, it just really depends on where your numbers are at. I mean, would your testosterone come back as? That's what we really want to look at. Yeah, 150 a week is really not that much. What's a prescription? So
The prescription is what the doctor or medical provider would give to the pharmacy. Thoughts on Nastrozole? My clinic says needed or doesn't, and others don't. Why the conflict?
Because some people have high estrogen, some people don't.
You're gonna be majority of people. So the whole point of it is that you're introducing this testosterone, and it's gonna aromatize into different things, and at that point it will aromatize into estradiol. So if the estradiol's not in check, you're gonna get water retention, irritability, possible gynecomastia. These are negative side effects. We don't want any of our patients to get it. So majority of our patients, all of them, start at least with a little bit of a blocker to start their regimen. And then, listen, if they're not feeling good or something's going on, we just retest their estrogen and their testosterone levels, and we dial that in. If it needs to be a little bit less, some people need a little bit more. Once we have that, you're in place, you take those medications consistently, you're going to feel consistent and get all the benefits without the negative side effects.
Yeah, you're definitely not going to have the negative side effects. A lot of guys crush their estrogen with letrozole or Femara. They get worried, oh, my estrogen's high, so they take that, and then they have a whole bunch of other problems. And Nastrozole is way better. Tamoxifen is way better.
Yeah.
Not for everybody, but I mean, I'm sure there's rare instances with letrozole or Femara. But don't just go for the strongest thing. You may not need the strongest thing, because then you're gonna have, no elbows and you're gonna have no sex drive.
Dude, this is the worst. You don't want low estrogen levels either. It's got to be a harmonic balance, man.
Yeah.
Can't be extremes on one thing and not the other. All right, I heard eating raw onions will boost my testosterone.
I'm not sure.
I'm not eating raw onions.
It might slightly, but I'm not. I don't even eat onions.
And listen, it might boost your testosterone, but how much? 100 points? 50 points? That wouldn't be worth it to me to eat the raw onions. Now, if it was going to boost my testosterone 900 points,
we'd have onions at Titan.
I would definitely be selling onions, man. I'd be selling onions to everybody. I'm like, take an onion, you take an onion.
I think steak or grass-fed beef would probably raise your testosterone just as much as onions would, and it's actual. And it has protein in it too, and it's actual food, not just an onion. So
we have all those other amino acids. That profile is the best profile, pretty much, in meats. That you're getting all those benefits. All these little things are working together, dude. All these little things. All these little things compile to a big thing. And that's us. And what we're gonna do. So really cool, man. The way the body works and all that, it's amazing. Jeremy, thoughts on Ozempic to shred? So he's talking about semaglutide. Listen.
Depends what you mean by shred.
Yeah, so a shred is, I guess, you're going to lose 10 pounds? Or you want to get rid of body fat?
I don't know, because some people, when I think of shred, I think of retaining the muscle that they have and giving it more definition, like shredding the muscle.
Right.
People that don't have muscle, they can't get shredded. They just lose weight.
Right.
So, I mean, are you looking to lose weight, or are you looking to actually, quote unquote, be ripped?
Yeah. So, I guess Drew's example would be him at 305 and then shredding down to 280, but retaining his muscle and looking the way he does.
Yeah.
So at that point, So, listen, if you want to lose weight, semaglutide, tirzepatide, these are definitely going to be the therapies for you to lose weight with. And if you want to gain muscle and lose weight, lean up, IGF-1 LR3. We were talking about it today. It's another one. And for you guys that are just tuning in, $25 special discount on IGF-1 LR3, any order that you do. And blood work special for males and females for Labor Day, $130 for males, $200 for females. You guys don't have to be a patient. All you guys got to do is call or text 727-389-3220. And if you are a patient, you can take advantage of this too. If you need blood work in 6 months, you just credit it to that 6 months, and bam, it's already paid for, and you got a discount. You're saving yourself some money.
Yeah, that's huge what he just said too, because that was what I was going to say. You guys don't have to use the blood work right away.
No.
You could actually wait 6 months to get it done, or you could just get it done now, just so you have it. The only thing is if you're doing lifestyle changes and stuff within those 6 months, you're probably going to have to get it done again.
Yeah, definitely.
That's the only thing I'll say. So don't come and get your blood work done, because I know how people like to study and do all this. They think they could tweak us, and you're not going to fool us at Titan. So you're not going to get your blood work done, and then come back 6 months later and say, no, this is my blood work from then. What have you been doing those past 6 months? Yeah, what have you been doing those past 6 months?
That's all you get, 60 days.
Yeah. My testosterone was a -10 6 months ago. Now it's 2,000. Wait a minute.
Elusive Man said, Liver King says, all I need to do is eat a lot of meat to build muscle. Well, he's not lying,
but not...
But that's not the only thing. I mean, look at him. I mean, come on. I mean, that came out, how much he's doing. And he wasn't doing crazy amounts if that was what he was doing, but he was doing a good regimen. Let's put it that way.
Definitely.
I mean, he was definitely doing a pretty good regimen.
Yeah, it was like 5 or 6 different things. High doses.
Growth hormone, GHRP, testosterone. I mean, he was doing.
MK677 is probably the safest thing that he was taking.
Yeah, I would imagine.
MK is testosterone, but the amount of growth hormone he was taking, I'm surprised his head didn't grow.
Yeah, this is true. But you got to build. Listen, you got to build muscle by eating. So he's not right. He is right on that, I guess. Tank estrogen. I'm sorry. Give me a question along with that. User, how much is the LR3? So we've got 3 doses that we do. We do our low dose, high dose, and Titan dose. So at that point, you can get on one of those, and it's like $315, $650, and $1,000. So you can get IGF-1 LR3 in any of those different packages. It goes 500 micrograms for the low dose, 1,000 micrograms for the high dose, and 2,000 micrograms for the Titan dose. You can use that all in 1 month, 3 months if you want to, and then at that point I would get off and let your body desensitize to it, or get more sensitized, I guess, back to it, and start being desensitized to it, and go on something else. And then you can go on a number of different things that kind of replace it and still work and get better gains and better progression.
And also, with those doses, those are the doses that we offer. If you want more, you could always order more too. So if you guys are looking at it and you want to get more than that, you can get more. But those are just the doses that we offer. So if you want low dose, medium dose, high dose, if you ask what our high dose is and you want more, just let the medical providers know and you can get more. But again, you're going to have your blood work done and all that before you even get set up with that.
Absolutely. All right, so I think we don't have any more questions. All right, so if you guys have any more questions, please shoot them at us. I guess we'll move on to the first topic of the day. There's a new tick, and I would hate to have this tick bite me.
Yeah.
There's a new tick in the U.S., and if it bites you, it will cause a red meat allergy.
Yeah, I didn't believe it, but again,
this is crazy.
Every week I have some crazy topic where it's
crazy.
Just like the thing is, when I first saw it, I thought it said red meat allergy.
Yeah.
And then now I'm reading it and I'm looking more into it. It says meat allergy. So the whole thing is like, I'm sure the vegans love this.
Yeah.
They love it. They're going to love it. Everyone's going to be eating flowers and plants and stuff. But it's not good that they can do this, because if they could do this, if they could, I'm not going to say make these ticks, but
I guess
if they can genetically engineer these ticks to make people allergic to meat, that means they're going to be able to make them allergic to other things as well. So meat's probably the first thing.
Yeah.
So
sure.
I mean, and the thing is are you going to know that you bit by this tick? Ticks are so small; it could go on you, bite you in your sleep.
Yeah.
And now 2 weeks later, you have a burger, you start feeling sick.
Well, they embed themselves in you, dude. If you don't get them off.
Yeah. They'll go in your skin like an animal where they have to pick it out. Like
you burn it out. That's why you have to get ticks. You have to burn them out, man. Had to do it to some dogs, growing up. We used to live in a lot of land, and dogs would always go out, run around. And at that point, like, we found a tick on them one day, had to burn it off. I mean, it's kind of creepy that you can just walk through grass and one can get you. And if you are walking through high grass, I'd always recommend to wear pants if you can. Yeah. That's the best thing to do to maybe not get bit. But
see, I'm wondering if they're going to have any type of medication, anything you can do to prevent this. Like, okay, maybe you can get some type of topical lotion or some type of shot or something where if that happens, it won't make that.
Right.
But it's just, they're going to start messing with our food now. It's like, it's bad enough that they're messing with the food you buy at the grocery store. Now they're making it so even if you do get bit and you have a farm and you have your own cows, you still can't eat the meat.
You'd be allergic.
What are they trying to? I don't know, man. It's getting pretty bad.
Yeah, this is nuts. This is definitely nuts.
They're watching what we eat. They're watching what we spend.
They're more of it manipulating.
Yeah.
They're manipulating to what they want for us to do.
Just think, if everybody's allergic to meat, then that means in like 100, 200 years from now, people go, oh, we don't eat meat anymore. Humans don't eat meat. What?
I don't know how we got to that point.
Yeah, I don't get it either, because meat is one of the most healthy things. I was watching a video last week about a guy that his daughter had all these health problems, like she's had some type of autism. And then, to make a long story short, they put her on a carnivore diet. So he's like, I'll do it with her. He did the carnivore diet with her. All next thing you know, his inflammation is gone, his heartburn's gone. Mm-hmm. He had a condition with his eyes, that's gone. And then there was a situation where the vegetables weren't agreeing with her. So he's like, okay, we'll just do steak. So literally, the only thing he eats now is steak, salt, and water. He's been doing that for months. I'll put the link on my page. And he feels the best he's ever felt. He lost all this weight. He's, I have no inflammation. I have no heartburn. I have everything just from going to straight steak. Now, I'm not saying everybody go to straight steak, but my whole point in that is meat is very important. Like, we need meat. I mean, this vegan, it's almost like, what is this? They should just call this the vegan tick.
I wonder what degree of allergic reaction they get.
Is it like a stomach virus, or is it like?
Well, is it is it like the throat closing or not? Let's see. Yeah,
Lone Star.
Not cool, dude. Not cool.
See, it says usually found in the Northeast.
How is it diagnosed? Or what are we asking?
We're asking what kind of allergic reaction it gets. Unlike most allergic reactions, the alpha-gal reaction is delayed, usually appearing several hours after exposure to red meat. Typically, allergic reaction includes hives, swelling, and sneezing. Wheezing, excuse me, I can't see that. Some people may also experience abdominal symptoms such as cramping, diarrhea, or nausea, and new research shows some people may only experience abdominal symptoms. Your doctor can do a blood test to see if you have the alpha-gal antibodies to confirm this is what is causing your allergy. So you can confirm what's going on. So that's good. And it doesn't sound like you're going to die from this. So, at that point, you can definitely go on and eat meat, I guess, but you might have some different symptoms that come along with it that might not be too nice.
Yeah, it's saying over-the-counter antihistamines, like certain things can treat it. Like, people have allergic reactions, and sometimes they may take a Benadryl or something like that. Okay. So, I mean, that should treat a little bit, but or EpiPen.
EpiPen's going to be prescribed. And that's usually if you have like something like that's going to close your throat, and usually somebody has an EpiPen that's close to them.
A lot of people had EpiPens when I was a kid, and I don't see them that much anymore.
No, not a lot of people have them around.
Yeah, it sucks that now they, what's next?
I know.
Next, they're gonna have one that says, it's gonna make you sensitive to sunlight, and it's gonna keep everybody in the house.
Like vampires.
Crazy. Yeah.
Caught.
I don't know, man.
Sister-in-law has it. Puke when she eats it. Wow.
What?
So this guy Dean Smith said his sister-in-law has the.
So I'm not gonna say it's true. I mean, it's happening already.
Wow. Well, it's got to be if they brought this news out. There's got to be a lot of people affected. I think it was 34,000 or something like that.
Has she? I mean,
wow.
So how often? How quick did it happen? Is she doing anything to treat it? Is it getting better? Is she taking the medication?
Does she take antihistamines?
Yeah. What do the doctors say if if this happens and you go into a doctor? They say stop eating meat, or they give you something to, block it, or is there some type of shot you can get where you can't? It's not going to affect you,
So So basically, like I know on allergy testing, what they do is they, if you go to an allergist or whatever, they'll go in there and they put all this different skin, and it might be touching your skin, and basically at that point, whatever gets a reaction, and they can formulate an injection that you'll go in and get to the injection to build antibodies to the allergy. So at that point, that gets the allergy shots. Yeah. People start becoming allergic to some of these different things. So I don't know if they can do it with this. They should be able to.
What's next?
Next one on here.
Next one's gonna be cheese.
Can Ozempic, Wegovy reduce alcohol, nicotine, and other cravings? Doctor weigh in on what we know. So at this point, semaglutide, that's the main active ingredient, and these are commercial drugs, Ozempic and Wegovy. There's been a lot of hype on these things as far as weight loss, and the proof is in the pudding. It's definitely helped. I don't know how many individuals lose weight that have never been able to lose weight before. So with this, there's other things that have been benefited from taking semaglutide. One, your heart health. You're less likely 20% to get any heart disease if you take this medication, which is really cool, right? And being able to lose weight is really cool too as well. But if this could help you with one of your other bad habits, and alcohol is a bad habit, nicotine is a bad habit, maybe drugs are a bad habit, opiates, right? That if this could help cure that addiction that you may have to it, or that want or craving, maybe not even addiction, but want or craving, because some people they like to have a drink when they get off work, right? And at that point, it starts to become a routine if they do it night after night after night, and that could get a little bad, I guess, to a certain extent, or they could probably feel better or not get the damage they're getting from it. This is really cool because at this point, the way that people really want things is because it increases dopamine. Certain items will increase dopamine in the mind. So if you know you're going to get, it's like a reward. So when you get a reward, your dopamine goes up.
Yeah.
So the drink is the reward at the end of the day, right?
Yeah.
The drug is the reward at the end of the day. So
or certain people, the cigarette is a reward after they're done eating.
It increases dopamine, and that makes them want to do it because they get a reward system in their brain. So with this, it actually regulates dopamine, so you don't get those high effects. So that's the way that it does, right? It's really, really cool. If they could be able to use this, now I don't think a real skinny person, let's say a real crackhead, should be taking semaglutide because I don't think it's going to be a good way for them to get off the medication or the drugs that are on medication. Jesus, they're drugs that they're on because the medication is going to make them shrink even more. Right? They're not going to be hungry and all that stuff. But for overweight ones, I think it might be a good way.
Yeah, overweight drug addicts or people that are just, I don't know. I think it works good.
Or
Because
you're
people
smoking or
get into a
drinking,
routine. Like, sometimes it's not even the chemical. It's just like what you said. It's just a routine. Like, I come home, I put my shoes here, I plug in my phone, I do this, and then if it gets off, you just automatically, sometimes you do stuff, you don't even realize what you did because you do it so much. And that's the reason why I feel like the gym is it's the best therapy for certain people because they go from one addiction to the other. They go from being addicted to numbing the pain and going out and drinking and always numbing. Now they're like, you know what? I want to get healthy. I'm going to stop doing that and go to the gym. Now they get addicted to the gym. They get addicted to looking in the mirror. They get addicted to the way they feel. That's a good addiction to have.
That's the best.
So if you can get it, that dopamine, like the same thing like me. As soon as I wake up in the morning, eggs, oatmeal, fruit, gym. It's like it's just in my it's
ingrained.
It's ingrained in me.
Dude,
so
it's
now,
wired.
Yeah, so now it's like if I don't do that, I feel off.
Yeah.
Like I could have an injury and I'm like, what am I supposed to do? I'm supposed to be at the gym right now.
Trust me, I feel you on
that. You'll be back soon. You'll be back soon.
But that's what it is though, and it becomes a habit. And it could be a good habit or a bad habit. Yeah. Going to the gym is a good habit.
Yeah, being obsessed with the gym is a good habit.
That's right. It is. It really is.
Being obsessed with illegal substances to make your body look good is not a good habit. So,
That's
but going to the gym, working out, being healthy, HRT, eating clean, you know, making sure you get water and sunlight and rest, that's a good addiction to have.
Absolutely, 100%. All right, Dallas apartment evicts tenant, throws belongings in dumpster, but it was the wrong unit. The wrong guy.
Crazy. Yeah, basically a guy lives downtown Dallas. He lives there, single dad, just him and his daughter. He came home one day. He noticed that his door was cracked open. There was a notice, eviction notice. He went inside. All of his stuff and all his daughter's stuff was thrown into the dumpster. He's trying to figure out what's going on. He went to the leasing office and they said, sorry, we made a mistake. It was the person that lived next to you. We took your stuff by accident. Now, the twist to this is normally if that happens, they make it better. But his ex-girlfriend, the apartment was in her name. I'm not sure if that's the mother of his child, but the apartment was in her name. So when he went to the leasing office to try to figure out why'd you guys throw away my stuff, they said we can't talk to you because you're not the person on the lease. Wow. So now he has to get a lawyer. He's got to fight it. He's got to do all this stuff. What's crazy is like, I mean, I think his lawyer is gonna get away with it because the lawyer said that the only reason they had to go into that apartment is for failure to pay rent.
Right.
This guy's paid rent every month on time. He has receipts for all of his payments that he paid. He's got everything. Wow. But they took his daughter's stuff. They took sentimental stuff, threw it in the trash can, and then people in the apartment in the apartment building, they went and picked stuff out the trash because you got brand new stuff. So half the stuff wasn't there. Half the stuff was damaged. Man. But think about it, even if he does get money back, he's still going to have to go buy all this stuff back. He's still going to have to, certain of his daughter's school stuff, it can't be replaced.
Right, sentimental stuff, yeah.
Yeah, so it's just, it just sucks. My whole thing is, it never mentioned once about him actually calling the ex-girlfriend to see what she would say. Because that with me, as soon as I come home, all this happens, they say we can't talk to you, I'm immediately calling her and be like, look, this is what happened. Can you call them and whatever,
Wow.
So now he's going to have to, look at all his stuff.
Wow.
All his stuff was down there. They went through some stuff. They took the other stuff. It's just look at people are leaving. Yeah. He said when he was walking down to the dumpster, he saw a whole bunch of people walking back in with lamps and stuff. His stuff.
Oh my god!
Because that's usually what happens if people throw away a whole bunch of nice stuff.
Man.
Yeah. So it just sucks. I want to see what's going to happen. I'm hoping the guy gets more than a little bit of money, a little pain and suffering. I mean, there's not too many. This guy's a single dad holding it down, got a nice apartment, got his daughter doing everything the right way. And then, I don't know. My moral of the story is don't don't live somewhere where you're not on the lease.
Definitely not.
Especially if you're the only one there, because this could always happen. Like, you never know what's going to happen. If you're living someplace and you're not on the lease and you're the only person there, they can come at any time and say leave.
For sure.
They could take your stuff. You just got to be careful, man. It just sucks. I mean, it sucks.
Big shout out to Stacy. What's up, Fanny Pack Stacy? Hold on, I said, but yeah, if he's not on the lease and if she doesn't live there, I think he's SOL possibly. I don't know the law as far as that goes. Yeah. But, I mean, if he's still paying rent there, then the chick obviously knows that he's still paying rent.
Yeah.
So maybe he could talk to her. And if she goes and says, hey, listen, that was my stuff you guys threw away, then they have to do it then.
That's what I would do.
That's what I would do, for sure.
I would call
100%.
and say, hey, look, say you were out of town and that's, we're arguing, you're out of town. That's all my stuff.
Yeah, for sure, 100%.
I don't know if that's the daughter. I'm not thinking it's the daughter of his child, because I think if it was, then she'd be more involved.
Yeah.
Maybe it could also be a situation where he was the one that left her. She's bitter, so she's not even picking up the phone. Oh well.
Yeah.
Because it's not his problem. It's not who knows. Moral of the story is you got to have control of everything.
Yeah, and if you're paying the payments on it, you better put your name on the lease.
Yeah. The thing is, he has the receipts. He's paying like almost $3,000 a month. He has all the receipts photocopied. He has everything. It doesn't matter unless your name's on there. So it could happen with vehicles too. They could pull you over. You could be driving a vehicle, and you could be making payments on it. It could be yours, but someone else is on the paperwork. They could take it.
No, definitely.
You always run a risk of that. Always
100%. What up, Keith? How you doing, man? Joe, how you doing? Yeah, so with this, what are the adverse reactions to peptides besides injections, site soreness, or itching? Ever heard of abdominal cramping? Yeah. Abdominal cramping can happen, depending on what the medication is. So if it's like semaglutide or tirzepatide, those can cause abdominal cramping. Usually when you're taking like GHRPs, like CJC 1295 and ipamorelin, you usually don't get abdominal cramping. I'm not saying it couldn't happen, but usually we don't get that response. It's usually, like you said, soreness or itchy or redness around the injection area, by the injection area, and that's the usually common reaction. There are different peptides out there that can possibly make you tired or a little woozy, or it can make you profusely sweat. I mean, I have that adverse reaction to one of them. So, there's some different things. Everybody's different. The masses of people, majority do not have issues, but there are some common issues that some do have, and that's what usually they get.
Another thing is it's not so much an adverse reaction, but a lot of times if people aren't injecting their peptide or anything that they're taking properly, if it's a sub-Q injection, sometimes it can get underneath the skin. Doesn't absorb. Yep. It may look like a little bump, a little pimple, which isn't a problem. You can usually just rub it in. Yep. But if you have that and you don't rub anything in, and then you start moving around, you might mistake that as a cramp. It could be on the side of your abs and may feel, oh, it's tight, it's this and that. So make sure you're not only just mixing your whatever you're taking, make sure you're constituting it properly, make sure you're injecting it properly, make sure it's going all the way into the muscle or sub-Q where it needs to be. If you cramp at one spot, move it around too. I mean, if sub-Q doesn't work for you in your stomach, which I don't like to do, put it somewhere else and see if we have the same problem. So.
Yeah, 2-minute warning.
2-minute warning, guys. Kakusha, CJC or IGF-1? IGF-1 all the way, but you only can be on it for like 3 months. So at that point, when you get off, then that's when you can go on CJC 1295 with ipamorelin. They're both together. And then this next thing after that was MOTS-C or combination. So MOTS-C is one of the therapies I was going to introduce next week that you guys will learn. It's great for weight loss. Great for weight loss. So at that point, I would do the IGF-1 with MOTS-C if you want to get an expedited result all the way around. You can do some different things with these two things. Or by themselves, they work well too. So either way, it's whatever you want to do as far as that goes. But I don't know. It's definitely some really good therapies that are coming out, especially for memory, for relaxation, anxiety, for sleep. I've got some good ones coming down the horn for you guys. So it's exciting times. All right. Barstool Sports CEO Dave Portnoy gets into fierce argument with pizza owner and gives him the bird and says what the bird means to him.
F you.
Yeah. So, if you guys don't know who Dave Portnoy is, this guy is the owner of Barstool Sports. And, cool thing I like about this guy is this. He built up this company, right, from nothing. Sold it for $500 million.
Yeah, like 30 seconds.
Right? Got the company back for $1. Now owns the company again. Really cool.
$500 million.
Got the $500 million. then something happened, and I got to read into what happened because I don't know, and I'll be honest. But what he does is he does a pizza review all around the country, and he goes in, he buys a slice, he takes one bite, and he says the review off that one bite. So he did not like this pizza, and he was giving a negative review, and this owner came out and said, "You shouldn't be judging me on just one slice of pizza, and this is, they're going back and forth." And Dave Pointer, he basically gave him the bird and told him, "Hey, listen, it is what it is. F you." So
I got 500 million. F you.
Yeah, and got it back for $1.
Yeah,
if you can get your company back and you get the money, oh man, you're killing it then for sure.
I saw on the screen that says, "Don't mess with a mass hole." I'm from Massachusetts.
Yeah.
I haven't heard that term in a long time. A lot of times people say guys from Massachusetts are women mass hole because they're kind of like gritty. I haven't seen that word in a long time, but yeah.
James Sorensen, where can I get TRT? From Titan Medical Center, from us. All you have to do is call or text 727-389-3220. And you guys can get a hold of any of our different therapies, and you can talk to our medical staff, and we'll be able to take care of you. All right, guys, that's it for Titan Lifestyle Friday with Big Drew. We appreciate all you guys showing up and conversating with us. And at that point, we'll be here every Friday, Titan Lifestyle with Big Drew, and we'll be giving you guys great shows.
Yeah, make sure you guys hit the bell on YouTube so you're notified of this video. Check out our podcast. And also, we're on TikTok and right here on Instagram. I'm Big Drew. We'll see you guys next week on Titan Lifestyle.